Assalamu alaikum and good morning. Today we will be in conversation with Dr. Rabia Sannam Khan, who is not only a dentist but a researcher as well as an aesthetician. She has done her master's in experimental oral pathology from Queen Mary University, as well as her postgraduate diploma in aesthetic medicine from Harley Academy. She's also done her PhD from Lancaster University, and currently she's working as the Director of Research and Education from ICE Dental Institute. She's also a program lead for non-surgical facial aesthetics. Assalamu alaikum, Dr. Rabia. How are you doing today?
Walaikum assalam. Thank you very much for your nice introduction. I'm good, thank you. How are you?
I am good. So thank you so much, Dr. Rabia, for taking time out in your schedule to have a chat with us. We will be having a couple of general questions we will ask you regarding your journey. So if you consent to this interview, we can begin.
Of course.
Okay. So this is just a very general question. This is very rarely asked, but also very regularly asked. Was dentistry something you always wanted to
do? I think like every regular being told कि doctor ही बनना है. So I said, yeah, of course, I was studious. I was just getting good grades. And then there is another thought process. Becoming a doctor is that it's such a long-term studies that you have to do. So why not go for dentistry? Yeah. So I straight away went into dentistry because I was being told and I was being fed that, you know, you have to study hard and you have to become a doctor. So this is how I started, definitely.
Okay. So what was the reason behind going into academia and research as a career choice?
Right. So I think it's a very long journey, I would say. I was being said that I had to do industry, but then I did find my passion in industry as well. And when I was doing dentistry, I had different kinds of interests, you know, like every other dentist. So I wanted to go in oral surgery. I went for PG cert in Japan to do oral surgery training out there. Then I was interested in endodontics. Then I was interested in you know, the most difficult things, you know, in dentistry, I would say pathology. So I linked pathology and surgery together. And then I thought that why not I just do something postgraduate. But that time I wasn't clear what I had to do, basically. I think when I did my oral pathology masters and I came back to my own university, only then I realized that what do I want in life and where my passion lies, basically. And I very instantly, you know, realized just within few months after starting my job in my university that I want to do something which is going to be very much beneficial to the world, and it's not going to be static as well. Okay. I can't do static things, you know. So this is where, you know, because I had a little initial experience of research from my master's in Queen Mary. So I started exploring that skill a little bit more. And right. I understood that this is something I really want to do, you know, and then I just continued and I never stopped, you know, afterwards.
Yeah. Okay. So Dr. Rabia, you have also worked as a lecturer in the UK in a couple of universities.
I have. So I've worked, yeah, go on.
No, I do want to ask you your experience, how it is working as a lecturer in the UK.
Right. So I think I started my journey in Lancaster University of lecturing, I would say. And that was pretty amazing because that comes naturally to me when it comes to research because I was so much into it. So I was lecturing the undergrad students and MSc students. So that was basically about research. So by that time, when I was in my PhD, so at least I knew the basics of research. So that was pretty amazing, you know. But now when I came back to my main job, which is the education director and research, I would say this is quite tricky because now I'm teaching all of the dentists who are graduated. They are doing their masters, they are doing their postgraduate degrees with us, and these are like 7, 8 courses altogether. And you have to lead the programs as well. So that's something very tricky, and tricky in a way that I find it interesting and tricky both. Interesting because it's something that I learn every single day, that how to improve myself. And that's where I took the medical education qualification as well from Manchester University, to just refine myself more and more, because even if you do PhD, you are improving your and refining your skills in research, but you are not a teacher by that time, you know what I mean? So
Yeah.
teaching qualification is something totally different. So I would say that it's something that I'm also teaching a little bit of Pakistani students. I would say Pakistani students, Pakistani dentists and UK dentists, both are really very extremely smart people. You know,
Oh,
you
wow.
are. They are, definitely they are, and you cannot get away from just lecturing them. Both of these cohorts, I would say,
Mm-hmm.
and they are someone that your each and every minute is really really important and really essential to teach them, because if they are not lecturing, if they're not listening to your lecture, that means they're earning some money out there. So you
Hmm.
have to make time worthwhile as well. So you
Yeah.
have to teach really, really effectively, and you have to make it more interesting as well. It can't be static teaching as well, in which you're just lecturing them. You have to make them involved in your teaching as well, which really includes, just doing some activities and asking their views, their opinions. So it's pretty interesting, but then I would say it's such a great learning experience as well, because no matter you have done your dentistry, you have done your PhD, but there are so much more. I feel I live by this, that there is so much in the world to learn, that even you're old enough and you have taken so many of degrees, you're still learning.
Yeah,
Every day is a
definitely,
learning.
definitely. I think the life itself is a learning experience up until the end. So very rightly said.
Definitely.
Thank you so much for that answer. And we'll move on to my next question. What is the procedure to apply as a lecturer in the UK? And do graduates that do apply for lecturership in the UK, do they still have to give OREs?
Right. Academics is quite different than clinics.
Okay.
This demarcation I got to understand here, I would say. Education is different, research is different, and clinics is different. So these are three different areas. So you
Mm-hmm.
have to decide that where do you have to go. And to get a lecturership in a university, the straightforward route is to do your PhD. And to be very honest, just a day before yesterday, we were having these conversations with our lecturers in the university, and they were talking about what do you have to do after PhD. So I have a full picture, So the full picture is that it's not very easy to
Yeah,
start with,
I'm sure.
but then you have to take your PhDs if you want to get back into academics of dentistry. You have to take your PhD in a university. And then if you have to teach in university, you have to go through, if you want to do postdocs, you can do postdocs. If you want to do some research assistant associate jobs, you can do that. And meanwhile, you are teaching as well. To get a university lecturership, you have to have your PhDs, and then you get the lecturership. When it comes to dentistry specifically, if you have done your um, masters, or if you've done your PhDs, what you can do is you can just start applying again in the universities. And there are different specific sites in which they advertise these jobs as well, academic lecturers or research assistant associates or officers. And then you apply through that. There is a whole interview process system, and then you get the job eventually, if you're lucky enough and skillful enough.
Okay. So, Dr. Rabia, during your journey in research in academia and up until the point where you have, mashallah, reached today, is there any troubles or any sort of bias work-wise that you may have faced during this journey so far?
I mean, where do I start from here? I'm just thinking
Oh,
on
wow.
where do I start from? It's not an easy. It's really not an easy journey. I'll switch to Urdu as well in between, okay? Because
Okay,
I
that's
don't want
fine.
to speak in
Yeah,
English
so
so
my
that goes
general
out in
question is
everyone's.
basically there's probably like a lack of appreciation for those that are in the research sector. Dentistry, when it's looked at as a career, most people have the assumption that, you know, they're going to move towards clinics, so they're going to have their own clinic, or they're going to give OREs, or they're going to, move towards that sector where they're going to be getting trained by the NHS, and then they're going to do their vocational training, and then they're going to go into private practice. So that's what the main assumption is. What my question basically is to understand what your journey has been like, and what are the troubles that women or people in general face when they choose research as a career path after dentistry.
Well, the first question that comes from Pakistan to here is, why do you want to do PhD? You have taken your master's, just go on practicing, with your patients and just live a happy life. For PhD, I would just say it's not something that I wanted to do to just get a qualification. All of my qualifications are not because I wanted to be, or amazing person, or with so many degrees. Not at all. I'm doing what I'm doing is because of my passion, first of all. And if your passion lies in that area, no matter if it's full of hurdles, you do it. And PhD is not even a single day, I would say, was not um, with any difficulties. It is such a torturous, not that torturous, but that different kind of torturous journey, I would say, not a straight journey at all. I think there are so many factors involved when it comes to funding, when it comes to living alone, when it comes to away from your family, when it comes to the complexity of research as well. And starting from Pakistan, being a woman, of course, the first thing comes up, just get married, just start your clinics, just enjoy your life. For any kind of questions that you would ask your professors as well, the first answer is, why do you want to do this? So if you're doing something, I mean, you need to be extremely passionate to not to listen to those voices as well, right? And then let's say you have made it, you have ignored all of those voices, and you have ignored the society norms, the cultures and everything. So because I'm from Sindh, I'm from interior Sindh, and
Oh
for us to
wow,
take just
where in interior
minimum
Sindh are
level
you
of
from?
education. I'm from Ghotki.
Oh wow.
Yeah, so I think I had been fortunate enough that my parents were like very much supportive in a way to just get your dentistry done, but that's it, nothing more than that. They were supportive by that time. Now they are supportive because now I'm trying to achieve few things and all that, but I had to fight for it. And it's not only the culture that you're coming from, it's the dentistry world as well in Pakistan. It's not something that they're going to appreciate you just do more and more, and they're going to be supportive, even though they're just going to just probably just not very motivating, and they will just say, just carry on with your life. So let's say you have ignored everything and you have moved in here and you have tried your thinking of starting your journey in a certain pathway. And when you start this journey, you think that everything is going to be smooth because now you have got the admission, you have arranged your funding, you have done everything. But from that time when you've taken the admission, the real challenges starts off. And PhD itself is a one project, but then it entails a lot of processes involved, which you have to bear with, you have to understand, you have to go through it, you have to be patient. And there is another mindset when it comes to dentistry and research, which is very, very different, to be honest. It is very different areas. Dentistry is something that we treat patients and then instantly we want to see the results as well. We have done the filling, we want to see a beautiful teeth, or
Yeah.
we've done the scaling, polishing, we have done the implants. Implants is also like a real big process, but anyways, we want the result at the end of the day. Whereas research is really not like that at all. So if you've started research, you cannot get the results very easily. You have to maintain your patience. to get to a point to reach to the first step of research. And if
Mm.
someone thinks that, this is what I used to think as well, that I'm going to do a revolutionizing kind of research and I'm going to change the world. I'm going to be the best in research. I'm going to be the expert in the world. But the reality is, you know, I'm brutally honest. I'm telling you, but the
Yeah.
reality is, PhD is something, the first step of research, and people think it's the last step. Rather, it's the first step, because in this PhD process, in these 4 years, you try to understand the process of research, and then
Mm.
you're being trained to do different types of research projects on the basis of that 4 years of training, I would say. So dentistry is a different world, you know, and dentist doesn't understand it. Even here, I wouldn't say that there is much awareness of research in dentistry sector. So they
Yeah.
are still establishing it, and same goes with Pakistan as well.
So, what
Yeah.
does your family back in Ghotki think of how far you've come along?
Um, I'm not sure whether every one of them knows about it or understands it as well, you know, to be honest. They don't understand it, that what I'm doing. I think they do have the same thinking that whether I'm married or not, whether I have kids or not, or, you know,
Right.
that family side is more important to every one of them. Yeah.
So I guess the point of us
But my
doing this interview or spreading awareness is so that people are more accepting of this as a career path and this as a passion and something to follow. So hopefully we can achieve that by this interview. Yeah. So my next question is, prior to this, you had worked as a reviewer for dentistry journal based in Switzerland. Is that correct?
Mhm.
Yeah, I just want
That's
to know
right.
if you can tell us what responsibilities you had as a reviewer of that journal and how did you land that position?
Right. Apart from the reviewer, I've just recently became the editor for that same journal as well.
Oh, wow,
And
wow, that's great.
yeah, so I think the process for it was, I had been publishing a lot of articles and books, you know, meanwhile, after doing my master's. So after my master's, my real career basically started, where I found my passion as well in research, and I published around about 50 publications, 5 book chapters and all. On the basis of that, because I had been publishing with them as well, they offered me the reviewer role, they offered me the editor role as well. And when it comes to the responsibilities, basically, it's something that they keep on sending you a lot of articles to review, and then you have to, there's a certain criteria, and there is certain templates as well that you have to fill in to just give the feedback to the reviewers, whether you have to accept that article or reject that article. I'm quite strict in that. I don't accept it very easily. But then this is what it really matters as well, because if something is going out, it needs to be authentic and validated. And in the same way, when it comes to editorial role, so there's this special issue. I mean, I've got this opportunity to speak to you all as well. I would say, if anyone is interested to publish in that special issue, which is on advanced oral cancer and dental implant research. So if anyone
Mm-hmm.
is interested in that specific area, they can publish with us. And you know, it's a Q2 journal, which is the 25 to 50% of the top journals of the world, and its impact factor is huge as well. So it's something that I'm very proud of, to be honest. I recently became the editor, and I'm proud of it because a lot of people get a lot of opportunities when it comes to research. They do become editors, they do a lot of reviews. But for me, this is something, my first article was with them.
Oh,
So this is
wow.
why
Okay.
it's huge for me that I am at the stage where I'm going to be accepting, or I'm going to be running a whole special issue for them. So yeah, that's nice.
So, for a dentist in Pakistan that would like to publish their article with you, is there a procedure to go about it? Is there a way to contact the journal or to contact you for that matter?
Of course, I can share the link of my special issue, and there is the whole information of the author guidelines, instructions for how to submit that, the templates, the English, the grammar, the statistics, the original articles, review articles, different types of articles. So
Mm-hmm.
everything is in there, and
Okay.
if you would like to share that link as well with all of the people, I mean, they can happily contact. They can happily contact me. They can happily contact the journal as well. At the
Okay.
end of the day, I think it will be our decision to accept or reject. But then it will not be my decision to completely accept it, because I'm just going to be inviting people, and then this will be reviewed by different people. So it's not something that's going to be biased as well. So it's definitely
Okay. Okay.
anyone who wants to publish. You're welcome.
Yeah, okay. Then you can share it with us, and then we will share it on our pages for anyone who would like to collaborate with the journal and share their articles.
Perfect. Thank you.
I just have last two questions. I honestly just want to know if there's a message that you would like to give to dentists in Pakistan, um, or what advice you would like to give dentists over here who would like to choose the career paths that you have chosen for yourself.
Right. I think my main message would be that after doing your dentistry, everyone needs a direction. So please do reach out to people who have the knowledge and information about the career pathways. First of all, do not follow the crowd. So we are being taught, we are being trained as treating patients. Although it's a noble profession, we are thinking of the benefits of patient care. We are thinking about patients themselves as well. We are thinking about a lot of the greed side of dentistry as well, like earning a lot of money also. So this is my biggest thing, to think about. If you will find your passion, everything will come through, and everything will come to your side as well, whether it's money, whether it's fame, whether it's peace, whether it's a luxurious life, whatever you need in your life. So always, do what you really like to do, and find your passion first, and then follow that. And when it comes to coming to UK, and as you said about my position and all, I will just simply say this is what I did as well. I did not think that I am going to UK for something, to be somewhere where I am right now at all. I had no futuristic vision at all. All I knew was that I'm passionate about doing something in a specific topic, in a specific area. So I would definitely would want to do that. And everything else came through by itself. So I think, because Allah and universe knows that if you are very much dedicated and passionate and very much focused on one thing, then they help you so much. And if you think that coming to UK and making a career in dentistry or research is next to impossible, it's really not. So if you have set a goal, you can definitely achieve it. But do take directions from the right people, I would say.
Okay. So, Dr. Rabia, last but not the least, there is a poll that us at Dental News Pakistan are asking all the doctors that we interview. Who makes a better dentist, in your opinion, males or females?
Okay. Such a tricky question it is.
Yeah, it is.
Oh my God, I mean, इसका मैं answer क्या दे सकती हूँ? I mean, I think,
Mm,
I mean, no logic to it. And I think the main thing is that females are very much detailed oriented. They are more towards perfection as well, rather than just getting the things done. So I think definitely I'll go for females.
yeah, okay. Okay. Well, that's all we have for today. Thank you so much once again for giving us this time from your schedule and having chat with us. I hope your journey and experience will help others in their respective career paths as well. And our aim has always been to impart knowledge and educate and spread awareness regarding future prospects in dentistry. And I hope that we've come to achieving this objective today. So thank you so much, Dr. Rabia. It was lovely speaking to you.
Thank you very much, Dr. Mania. It was really, really nice speaking to you as well. It was a fun interview. And anyone who would want to have any advice, please reach out to me. I'm always there. And thank you very much for everything. And I hope to see you
Definitely.
soon then. Thanks for your time.
Thank you. Thank you.